Assalamu alaikum. Let's talk about abdominal incisions. First of all, midline incisions. This is the commonest approach to the abdomen. Structures that are divided or linea alba in the midline. Okay, transversalis fascia, extraperitoneal fat, and peritoneum. Uh, when we open the abdomen, we'll encounter falciform ligament above the umbilicus. So avoid cutting that. Bladder can be assessed by an extraperitoneal approach through the space of Retzius. Uh, when we open the abdomen, before opening the uh, peritoneum, if we want to approach the bladder, we can approach it through the Retzius uh, space. So let's see what is Retzius space. The space of Retzius, also known the retropubic space or prevesical space, is an anatomical area located behind the pubic bone and in front of the bladder. So it is an extraperitoneal, a space filled with loose connective tissue and fascia. This space is clinically significant due to involvement in various surgical procedures and potential for pathology. So if we see in this diagram A, in female patient, space of radius or retropubic space, and also in diagram B we can see it in a male patient. So this is the midline incision, or another one we have paramedian incision. Paramedian incision is here we see the paramedian incision. It is parallel to the midline, about 3 to 4 centimeter. Structures that are divided or retracted are anterior rectus sheet uh, and the rectus muscle that is retracted in this case. A posterior rectus sheet, transversalis fascia, extraperitoneal fat, and peritoneum. When we opening the peritoneum, we will approach to the abdomen, and incision is then closed in reverse order. Then we have battle incision, that is similar to the paramedian incision, but rectus is displaced medially and thus denervated. Now seldom used. It is not too much used. Here we can see the battle incision. It is also like paramedian incision, but the rectus muscle is um, displaced medially. Here we can see the nerve supply of the rectus muscle. The rectus abdominis muscle is primarily innervated by the thoraco-abdominal nerves. Thoraco-abdominal nerves occur continuation of the lower six intercostal nerves T7 to T12. These nerves enter the rectus sheath by piercing it and anterior surface and provide both motor and sensory innervation to the muscle and the overlying skin. Here we can see this diagram, the uh, nerve supply of the rectus. So here is the battle incision, just lateral to the rectus, and when we cut it and retract it medially, it will be denervated. This incision is uh, nowadays not commonly used. And another one is the cocker incision. Cocker incision, or incision under right subcostal margin. It is mainly used for open cholecystectomy. Another one is Lanz incision. Lanz incision is in the right iliac fossa for appendicitis. When we are doing open appendectomy, we are using a Lanz incision, and another one is great iron incision. uh, Lanz incision is cosmetically good, and we mostly use it in pediatric age, and the great iron is used in when we are doing an appendectomy in a patient uh, of more than 13 to 14 ages in adult age. So Great iron incision is oblique incision. So these both incisions are in right iliac fossa. We are mirroring the umbilicus and anterior superior iliac spine, and lateral one third and medial one third is the McBurney point, and this in this point, where there is a transverse incision, that is called Nernst incision, and if it is oblique incision, that is McBurney or great iron incision. Another one is glebe or rooftop incision. This is the incision. This is called the glebe or rooftop incisions. When you're approaching the upper abdominal organs like stomach, like liver, we are mostly using this incision, and in this case the incision is closed by staples. And another one is Feinstein incision. Here we can see the transsupra pubic incision that is primarily used to access the pelvic organs. For example, in C-section, we are doing a C-section and we are going to give up Feinstein incision. McEvedy incision, it is groin incision. Here we can see a groin incision, emergency repair of strangulated femoral hernia. If it is a strangulated femoral hernia, we give a groin incision, that is called McEvedy's incisions. Another one is Rutherford Morrison incision. This is like uh, it is like great iron incision, but whenever we cut the muscles like external oblique and continue that, it is called a Rutherford Morrison incision. You can see in this diagram, it is extraperitoneal approach to the left lower quadrants, and gives excellent access to the iliac vessels, and its approach of choice for first time renal transplantation. It was an MCQs that which incision is used for first time renal transplantation, that is Rutherford. My son, thanks for watching.